Very good morning to all of those who are joining me live. I'm Neha. Now, COVID-19 has created havoc in the entire world ever since its origin. Many people have succumbed to this deadly virus, while many are fighting day in and day out for theirs. India is the second worst hit COVID-19 country with 47,54,356 cases. The global death toll has also reached 78,586. But silver lining is the number of recoveries, which currently stand at 37,02,595. States like Maharashtra, Andhra Pradesh, Karnataka, Tamil Nadu and Uttar Pradesh contribute the most to the COVID-19 tally. But these states also add the most to the recovery rate in India. In fact, as per Union Health Ministry, 58% of the recovered cases are being reported from Maharashtra, Tamil Nadu, Andhra Pradesh, Karnataka and Uttar Pradesh. Now, these five states account for around 60% of the total 9,73,175 active cases in the country. Talking about the recovery rate of the country stands at 77.88%. Maharashtra has reported 17.2% recovered cases, Tamil Nadu 13.1%, Andhra Pradesh 12.2%, Karnataka just 7.9% and Uttar Pradesh 7.8%. The Health Ministry said, and I quote, nearly 57% of the new cases are reported from 5 states. These are also contributing 58% of the new recovered cases. Now, to understand more about India's growing COVID-19 trajectory, joining me over the phone line is Dr. Pratik Patil, who is an infectious disease expert. Thank you very much, Dr. Patil, first of all, for taking out some time and speaking to us. Sir, help us understand India's growing COVID-19, map. You have 5 states contributing the most to the active cases as well as to the recovery rate. What does this imply?
Yes, good morning. So, if you see these 5 states which are contributing maximum to the recovery, these are the 5 worst states who were hit initially. That's how the pandemic progressed in India. These 5 states contributed most cases initially, and that's how you see that recovery rates are also better in these states at the moment. So they are already passed on the epidemiological curve, and some of the states are still, reporting more and more cases. So this just represents the timeline of the disease. So that's a good sign, though. And only thing that worries me is that the second peak wave that is appearing in Delhi, the same thing should not happen in the other states. We understand that nearly 97 to 98% of the people will recover from COVID, and only 1 to 2% will have, or maximum 3% most of the times will have some bad outcomes in terms of mortality. So 97 or to 98% are likely to recover. But what we should worry is that we should be worried about is second wave. So people should be careful all the while, because if you drop your guard, the second wave is likely to come. That's what we are seeing in Delhi, that the cases are surging again. After initial spike, there was a lull period for a couple of months, and then more and more cases are being seen now. So that worries more, because the cases are bound to recover after they get infected. So we should be still careful.
All right. In fact, I beg your pardon, it was not global death toll, which I earlier mentioned. It was India's death toll, which currently stands at 79,722. Right. Talking about the second peak of COVID-19, Dr. Patil, this is something that's been widely discussed as well. So would you be able to tell us, are we already witnessing second COVID-19 peak in India?
See, again, India is a big country.
Right.
So you cannot say a country as a whole. If you talk about country as a whole, we are still to peak. If you see the graph, the daily number of cases are still rising. We haven't seen a real decline in the number of cases followed by a real, again, increase. So we are still peaking as a country. We have not peaked yet. But as a cities or states, city as a Delhi city had peaked sometime in June or so. Then the cases were less, and now again the cases are increasing. So possibly I would discuss it based on a geographical or particular city-wise or state-wise data. So because some cities are still reporting more and more cases, they never saw a decline in the overall trend. So we have to take it in that way.
Okay. So, Dr. Patil, coming back to these 5 states, why are these 5 states in particular recording the highest number of cases in India? Can we now expect the cases to decline? Talking about the second part of it, of course, as far as we see, the cases have shot up. Will there be a decline now?
It's very difficult to predict the decline when it happen. It depends on the population and general public's carefulness to follow all the precautionary measures so that the transmission is halted and lesser number of people get infected. So it's very difficult to predict.
Right. So, Dr. Patil, life is moving back to normalcy in the country. People have started to live with the fact that COVID-19 is present. Does this mean that the fear of being infected with COVID-19 is lesser than before?
I think, yes, it is lesser. There are two reasons. Already people have understood that this is not going to go away in 1 or 2 months.
Okay.
It is likely to stay longer. The only thing that will save us is continuing the precautionary measures and vaccine whenever it's available. Other thing is people have realized that not every time you get a COVID is going to be a fatal outcome. You can manage the cases at home. Home isolation is quite well possible, And
but I'm sorry to interrupt, but that clearly does not mean that we can take lightly the threat that COVID-19 poses. Because if we step out today, let's talk about today, Dr. Patil, I see no social distancing is maintained. People are hardly, wearing masks. I've been saying, although of course I'm not a doctor and this is not my area of expertise, but I have had conversations with several doctors who have been trying to make people understand that it is extremely very important to wear mask at the least to reduce the risk of getting infected. It's for their own good. So why is it so difficult for people to take basic precautionary measures? I'm not even talking about, staying all the day at your home. I'm just talking about basic precautionary measures. Why do you think is the case?
See, it's very, it's surprising. People take it so lightly. That's why when I was still talking to you, I told that it's up to the people's own precautionary measures. That's what is going to help us in reducing the peak or reducing the chain of transmission. Now, they're talking about just wearing of mask. You see many people wearing the mask below their nose, on their chins. That's also another harmful practice. Ideally, the mask should cover your nose and mouth, both of the things. So how many people are correctly wearing, that's the second question. Even if they're wearing, how many of them are
wearing it correctly?
That is another important point to discuss. So that's true that we should not get carried away with things like it will not harm you at all. You should be careful, but again, you can't be sitting at home all the time. The work has to go on, but again, whatever unnecessary has to be avoided. It has to be essential things if you want to venture out, only if it's really necessary.
Right. Lastly, Dr. Patil, how important is testing as a factor? Because we see, in a few states, like we've mentioned as well, the numbers are much higher than the others. Is it because of more infected people, or can we also attribute it to wide-scale testing?
It's both ways. It depends on the availability of the test, how easily the test is available. And also, second thing is how aware people are about the symptoms. Because it may happen that if somebody has a very mild symptom, they may not report also. So it depends on the awareness. Let's say if you talk about metropolitan cities, the awareness is likely to be much more than the rural areas. So it also depends on that kind, demographic factors, how aware people are and how they take seriously about these symptoms.
All right, Dr. Patil, thank you so very much for joining us live. Well, there you heard it from the doctor himself, who has been saying that it is absolutely very important to take all the precautionary measures, especially when you're stepping out. Otherwise, work from home is always the option. Of course, for those who do not have the option, please make sure that you're taking all the preventive measures, maintaining social distancing, wearing mask and wearing it correctly, more importantly. Please take care of yourself as well as your family members. As I've been saying, especially if you have elderly at home. Thank you so very much for joining me. If at all you like this video, do not forget to subscribe Newsline YouTube, like us on Newsline Instagram, Facebook as well as Twitter. Stay safe, take care of yourself.